Let's talk about the erythrocytes in detail. We already discussed recently that about the properties of the erythrocytes, that their shape and their lifespan. Lifespan 120 days. So your RBC from the time it is released into circulation till it dies in the spleen is 120 days. And we know the shape, it is a discoid shape. It's shaped like a disc. If you look at it from the side, it's got the biconcave shape over here. It's around 7.2 microns in diameter. So 7.2 microns in diameter. And the periphery has more redness compared to the center. So there's a central pallor and a little more chromicity. Chromicity means color in the periphery. The periphery is 2.2 microns in thickness, making it a little thicker on the periphery compared to the center, which is only 1 micron in thickness over here. So these numbers are important to remember. We spoke about the normal RBC count, so I said that males have around 3.5 to 5.5 million RBCs per milliliter. Now females, they have a little lesser number of RBCs, 3 to 5 million per ml. Different labs have different reference ranges. Different departments where you work will have a few different reference ranges. So the RBC holds hemoglobin and its different forms over there. So this hemoglobin, why is it kept in the RBCs? Because it is a very viscous material. You don't want it freely floating in the circulation. It would make your blood very, very thick and give you a very bad day. Your heart's going to have a hard time pumping a thick solution of hemoglobin. Blood's already thick compared to water, but our heart can pump that. But if you give hemoglobin freely in the circulation, you're going to have a bad day. It'll cause heart failure. Then the hemoglobin has iron, a heavy metal. If it is left in the circulation, the heavy metal can cause free radical generation. So free radicals can form like hydrogen peroxide, superoxide, that is O2 minus, and hydroxide, the most dangerous of all. This is made by the Fenton reaction. So the Fenton reaction is where you have free heavy metals just floating around, and that gives you a bad day. Again, making these free radicals that cause the aging of different cells, damage the cells over there. So that's not good. The cells die faster. And if you leave the hemoglobin free in the circulation, it will attract more water via osmosis into the vascular compartment, increasing the volume and again the load on the heart. So you don't want that. So to prevent the hemoglobin from exerting osmotic pressure, osmotic pull, so we will keep them in RBCs. Okay, so this is what we've already discussed, and we've spoken also about Role formation and all of this. Now, there are some other interesting concepts you should know about the RBC. Some measurements of the RBC, we call them the RBC indices. RBC indices. These are numbers that tell you that pertain to the properties of the RBC, the characteristics of the RBC. For example, if we look at this one, the first thing, what is the volume of one RBC? So that is called the mean corpuscular volume. This is the first index we are going to talk about, mean corpuscular or cell, or you can say, red blood corpuscle. So mean corpuscular volume. Now, this is the average volume of one of your RBCs. If you take an RBC from your circulation, there's a chance that the RBC's volume should be somewhere in close to this number. So how do you get this number? There's a formula. Now the formula is you take the hematocrit, okay? MCV, mean corpuscular volume, is equal to the hematocrit divided by the number of RBCs per liter, not per ml, per liter over here. So what's happening over here? Remember what is hematocrit? You take the blood in a tube and you centrifugate your blood. What are you going to get? You're going to separate the cells over here, and you're going to get plasma on top. So remember, the hematocrit is 40% for females, this volume in the tube you get, and 45% for males. So females have roughly around 40 and males have 45%. Plasma can be between 55 to 60%. Again, based on the ratio over here, it adds up to 100. So this is your hematocrit, or your volume of packed red cells. Some people say packed cell volume, PCV, or you could say packed red cells also, because what happens is when you do this centrifugation of the blood, you centrifugate your blood 3000 revolutions per minute for some time, you will get your red cells over here, but there will also be a layer of platelets and white cells on top, and this is called the quantitative Buffy coat. Quantitative Buffy coat. So on top of that is plasma. All right. So there, when we are talking about hematocrit or this one, we would prefer to use the word volume of packed red cells, because we are trying to disregard and not look at the volume taken up by the platelets and the white cells for accuracy's sake. Okay, your RBC is outnumbered the WBCs by like 700 to 1. So, but just for accuracy's sake, you can say volume of packed red cells to be more impressive and to be more specific. So this, by the way, if you want to know why we use a Buffy coat, it's sometimes used to diagnose malaria. So if a person has malaria, we would like to see if that parasite is growing if the white cells have caught a few of those parasites. So we try to centrifuge the blood, take the white cells and run some tests for malaria on the white cells, where you'll get plenty of those parasites and you have a higher chance of detecting malaria in that person. So that's why you have the quantitative Buffy coat. That's a microbiology topic, but it's okay. I thought we just talk about that also. Anyway, so let's calculate this. The MCV, how much is it? Hematocrit is around 0.4 to 0.45. So let's just take 0.45, because percentage is that number divided by 100. So that's what we got. We got 2 decimal points over here. 45% divided by 100 gives you 0.45. This is the hematocrit, or volume of packed red cells. Same thing. Yeah, I'm using it interchangeably. You see that? Same thing over here. So here, hematocrit divided by the number of red cells per liter. So you remember in men it was between 3.5 to 5.5 million per ml. So let's say it is 5 million per ml. So how much is that in liters? It's like 10 to the power 6 into 10 to the power 6 again. Because that's in ml, and then you get the liter over here. So that gives you your this one, 0.45 divided by 5 into 10 to the power 12. This, if you this is per liter, remember, so this is per liter, so that's why we added this 10 to the power 6 over here. This comes somewhere to 90 times 10 to the power minus 15 liters. So this is 90 femtoliters, small f L. Femto is 10 to the power minus 15, okay? So 90 femtoliters. So the average red cell volume is 90 femtoliters. So that is between 80 to 100 femtoliters. Why am I emphasizing on this? Because this is the most important index. No matter what other index you study, mean hemoglobin concentration, mean corpuscular hemoglobin concentration, or red cell, or these other red cell indices like the chromicity, it doesn't really matter. It really doesn't matter. Believe me, the main index you need to know is about the MCV. Why? We diagnose which type of anemia a person is having just by looking at the MCV number. So remember, anemia, reduced red cell mass in the vascular compartment, in the vascular tree, that is your anemia. Well, if you have less hemoglobin, it might be reflected by low hemoglobin. So you take the blood, you check the hemoglobin is low in your patient, then you think, okay, what kind of anemia might he be having? There are different causes of anemia. There could be anemia caused due to deficiency of iron, deficiency of vitamin B12, folic acid, or a person might have cancer that is infiltrating his bones and destroying all the machinery that's making new red cells. That's the erythropoiesis does not happen in these people. Sometimes the bone marrow is poisoned by radiation or by chemotherapy. So how do you get a clue which kind of anemia a person is having? Just look at the cells volume, you'll get an idea. So how? So look, the average the normal range of MCV, never forget this, is between 80 to 100 femtoliters. A cell which has the normal volume is called normocytic. Normocytic, normal size. If a cell is less than 80 femtoliters in volume, it is microcytic. And if it is more than 100 femtoliters, it is called macrocytic. So there's 100 femtoliters. It is called macrocytic. Big cell, small cell, normal cell. Okay. Now look, most of your cells should be normocytic. But if your hemoglobin is low and the size is normal, that has a different cause. If it is, hemoglobin is low and the cells are small, you think of something else. And if the hemoglobin is low but the cells are large, different causes. So I'll just give you a small taste of why this happens. Now, imagine you lose a lot of blood in an accident. Right? A patient loses a lot of blood in an accident, not you. Let's be positive. Give some positive vibes over here. So a person loses a liter of blood. Okay, out of his 5 liters of blood, he's lost 1 liter in an accident. Very sad. So if you take his hemoglobin, it will be low, and the cells in his blood will be normal sized because they were normal to begin with. So for example, a normocytic could be blood loss. Then there are causes of normocytic anemia where a person's immune system starts destroying his own red cells. So he makes normal cells, but then his immune system starts destroying it. Your cold antibody hemolytic anemias, your warm antibody hemolytic anemias, the ones that are caused by the immunoglobulin M and the immunoglobulin G, or even mismatched blood transfusion. Somebody has a B blood group and you give him A blood. What's going to happen? There's going to be a graft versus host reaction. The antibodies from both sides are going to start killing each other's cells, especially the host cells are going to, the host's antibodies are going to kill the donor's RBCs that are coming with a different antigen. So in that case, you start to destroy a lot of cells. So again, the remaining cells which are untouched will be normal in size. So like blood loss hemolysis, this is what you put under